let's talk about lipo. Now, lipo, and I've heard this quite a bit myself. Once you have lipo, do you ever gain fat back in the area you had lipo? And does it take away all your cellulite? I've had people come in and they've had lipo
is this?
and they're like, oh, I can eat whatever I want now, right? And I'm like, no.
All right, let me sip my Diet Coke and get to
Diet Coke for this one. Sorry, Diet Coke, I cheated on you.
The best way to summarize fat is that you have a limited number of fat cells. And when you gain weight, those fat cells get bigger. And when you lose weight, those fat cells get smaller. You don't make more fat cells. So you have your fat cells, they're getting bigger or smaller. People tend to have their fat cells get bigger or smaller in different places, right? So for me, my legs, my thighs, my butt get bigger first and smaller last. And my ridiculously bony wrists get
so
smaller
random
first and for whatever reason and bigger last. Not that I'm looking for, Popeye forearms, but it's never going to happen.
I've never looked at my forearms and been like, oh, damn, you gained some weight.
Right? No, that's how you know God's not a woman. So it always goes somewhere else. Maybe it's around the middle. Maybe it's around your butt.
Mine always goes to my legs first.
Yeah. For some people, it's around the abdomen. For some people, it's the chest. Whatever. Anyway, so when you liposuction, I'm removing fat cells. I'm not making them bigger or smaller. I'm just legit taking them out. So if I lipo your abdomen, because that's where most of your fat is, then I'm reducing the number of fat cells in that area. So the next time you gain weight, your fat cells that are still remaining in your in your abdominal area and your waist will get bigger, but there's less of them. So proportionally, it gets less large than where I haven't touched anything. So maybe your arms, those fat cells get bigger and you feel like proportionally your arms are getting fatter, but they're not. It's just you have less fat cells in the area that I liposuctioned. It is not a weight loss procedure because you still have fat cells left. If you gain weight, the fat cells that you have in your body are going to get bigger. So you can't eat whatever you want. You can, I guess, and then come back for more lipo, but that would be the only way that would work. Yeah. And then with regards to cellulite's not caused by fat cells. Cellulite is caused by these little fibrous septae between your skin and the subcutaneous tissue underlying it. And those little bands are pulling on the skin and creating that dimple. And then the fat around it looks more protruding. If you gain and lose weight, that can change how that cellulite appears, but it's really those fibrous septae that have to be cut to get rid of the dimple.
So you're telling me that all those cellulite be gone creams aren't doing it?
Yeah, no, the bum cream's not a magic fix. Damn it.
Bought that in bulk.
A lot of times those creams have caffeine in it and it's tightening the skin surface a little bit. So it will temporarily make things look better. But yeah.
So is there any treatment that does help with cellulite?
As a matter of fact, there is. We do it in our office. It's Avali, and it's a small wand that has a little hook and a tiny, tiny little blade at the end. And after we numb the patient up, I can go in and each cellulite dimple that I've marked, I can go in, hook the septae that are creating the dimple, and then cut the septae. And it's just targeted reduction of those cellulite dimples. And it's very effective. Yeah, and permanent. So we like doing that.
It's magical.
Yeah, we love doing that, actually. It's magical.
It is. And it's something cool because you see the results right then and there.
Right. Once you get over the bruising, then you're good to go. So it's really nice for cellulite.
And what area specifically do you do the Avali treatment in?
So Avali is FDA approved and indicated for buttock cellulite and posterior lateral thigh cellulite. So any cellulite on the backs of your legs and just a little bit laterally to that. A lot of times what people think is cellulite on the front of their thighs is laxity. So that's just your skin kind of getting a little saggy.
That's when you get that bum cream.
Yes. Then the bum cream helps. And there's some other things.
A little Renuvion.
Yeah. There's some other non-surgical tightening maneuvers. You could do microneedling. There's so many things you could hit at your body. That's what I'm saying. Someone Christina Aguilera, who's lost weight, if she's doing it slowly and is, doing creams and radiofrequency microneedling and maybe some, Renuvion or Body Tight and some BioRepeal to the legs and is like attacking it consistently, maybe she doesn't need any skin excision when it's all said and done. But it's a huge investment of time and money to stay on top of all that. Or you could just Photoshop it for your cover.
Yeah, it's fine.
I want that Photoshop.
Nothing a little face app can't fix.
That's right.